vaccination status?
It is concerning. I've been watching this for some time. I gather that there were 6 or 7 provinces that had a difficulty with measles this season. We know that our first ground zero case happened, I believe, at a wedding in Ontario. And there are a couple of different communities, our Hutterite communities and our Mennonite communities, which do tend to have a lower vaccination rate. We did do some targeted campaigning to increase the vaccination rate. We were quite successful. We saw an uptake, a 50% uptake in the number of measles vaccinations in some of those communities that tended to be have a lower vaccination rate. And I'm glad to see as well that the numbers appear to be abating. I think the last time I looked, we still had an outbreak of a handful of cases. And so I know it takes a 12-month period before you're measles free, before you can get that status back. I think our outbreaks began somewhere in March. They were a lot earlier in some of the other jurisdictions, but I think it's up to everybody to be vigilant in trying to make sure that this disease doesn't spread. It can have devastating impacts, especially on young kids, and so we want to make sure that everyone knows it's available. We made micro doses available for those who are underage as well. We made sure that we put messages out there that women who are considering getting pregnant should also make sure that their vaccine status is up to date, because once they're pregnant, they can't get the vaccination. So we've been doing a pretty comprehensive campaign on targeting that message.
Can you think of anything other than the campaign that could help regain the status?
I think really at this point, because it comes in from multiple different sources. Again, in the early days, most of ours was being caused from outside travel coming in. And so because we do have a very open society, we have people who are able to travel freely between Alberta and the rest of the world, travel freely from one province to another. Sometimes, and that's why we made sure everyone knew when an outbreak was occurred, or when a case was identified. We put on our website so they could see exactly what location, judge their own level of risk, if they saw symptoms, able to get it addressed right away. But it seems to us, looking at the data, is that it was concentrated in a number of communities that have a historically low vaccination rate, which is why we started doing some of the targeted campaigns to increase the vaccination.